This is breaking news.
Here's Governor Murphy giving an update on the coronavirus pandemic in New Jersey.
Judy and her team and Pat and his team to help get these shots in arms as soon as possible. So the last time we were together, basically 10 days ago, I said the added protection of a booster is not a bonus, it's a necessity. That statement is even more true today. And the early data of the ability of the Pfizer vaccine in particular to enhance protection against Omicron bears this out. 1 week from today, Judy, it's hard to believe, we were standing shoulder to shoulder at University Hospital. It'll be the 1-year anniversary of the first vaccinations against the coronavirus here in New Jersey. The best way we can celebrate this milestone is by getting our boosters. And to help facilitate, making it easier, Judy and her team are making next Wednesday Boost NJ Day. And I know she'll have more on this in a few minutes. As we look to the overall performance of the vaccines, we see that they continue to perform exceptionally well in protecting vaccinated individuals against the infection, hospitalization, and death. This is now, remember, this is our entire lived history with the vaccines from January 19th through November 29. And I think even more relevantly, here are the preliminary numbers for the week of November 22nd to November 28th. This is preliminary data, but it's important to get a real-time snapshot, which shows that even as some individuals' protection may have begun to wane, which is the reason why, by the way, everyone needs to get a booster, the initial vaccination courses continue to perform very well. Let's now go to the rest of today's data. And starting today, we're going to do things a little bit differently than we have for many of these briefings. Instead of the one-day numbers that we had been showing, we're going to give you week-long look-backs for new cases, hospitalizations, and deaths. And so as we have moved back to the once-a-week briefings, and by the way, we'll be back with you live unless you hear otherwise this coming Monday. But as we moved to the once-a-week briefings, and frankly, even before, the one-day snapshots we had been presenting lacked a lot of context. We're hopeful to better frame the data by showing them against the prior week so you can see the ebbs and flows as we have. And we hope that this will not only put these numbers in a proper perspective, but also hammer home the reality that everyone needs to get vaccinated and then get boosted. We know the overwhelming majority of our new cases, new hospitalizations, and new deaths, sadly, are from among the unvaccinated. And as we turn now to the number of cases, as you can see, it becomes quite obvious that we have experienced, as we expected and predicted, a post-Thanksgiving spike. There's no other way really to look at these numbers. The combination of colder weather, going indoors, and then layering on top of that a uniquely American holiday, we believe that combination is what's driving what we're seeing here. So from these, we cannot let our guard down, especially if you aren't vaccinated and if you're in a crowd, whether it be in a store buying presents or in a bar or a restaurant or at a party. It is safest and wisest to mask up, especially if you do not know the vaccination status of those around you. And as would be expected from a surge in new cases, our hospitals are also seeing a surge in new COVID-related admissions. Now, surely our numbers across the board are roughly 1/3 of what they were a year ago at this time, thanks to the vaccines, I might add. But keeping our healthcare system strong and capable of caring not just for COVID patients, but everyone else who needs care remains of paramount concern. The burnout that our nurses and doctors and other staff members are experiencing after now what is basically 21 going on 22 months of the pandemic cannot be overlooked. Next up, here are the newly confirmed, with the heaviest of hearts, I might add, deaths going back since last Monday. And look at today in the context, again, of the past 9 days. Moreover, sadly, it is very, very likely that most, if not every one of these deaths, or at least the majority of them, could have been prevented through vaccination. Now, as we always do, let's honor the lives of 3 more of those who we have lost. First up, we'll start by remembering Woodland Park's Phyllis Santanastaso. Phyllis spent 42 years as a registered nurse at St. Joseph's in Paterson, then continued her career at an adult daycare center in Nutley and at a private practice before retiring. But even then, she kept busy by volunteering at St. Joseph's, where she was also a member of the Nurses Alumni Association and volunteering with the Little Sisters of the Poor in Totowa. She was predeceased by her first husband, John, in 2003, and her second husband, Lawrence, in 2016. She is remembered today by her children, Anne Marie, with whom I had the great honor of speaking last week, and Vincent, and their spouses and families, including grandchildren, Allison, Amanda, James, and Leah, along with many other relatives and friends. And by the way, James works at the Motor Vehicles Commission for the state of New Jersey. We thank Phyllis for a lifetime spent in service to others, and may God bless her memory and the family she leaves behind. Next up, we honor this gentleman, Eugene Fitzpatrick, a longtime resident of both Livingston and East Hanover, a retired database administrator for Foster Wheeler and then Novartis Pharmaceuticals. Gene played guitar and was a huge fan of the Rolling Stones. Excuse me. He loved summers on Long Beach Island, and in the autumn was an avid, long-suffering Jets fan. He was also a Corvette buff and a proud member of North Jersey's Natural Glass Corvette Association. Gene was sadly predeceased by his son, Michael, to whom he was a devoted dad. In addition to his wife, Cindy Lou, with whom I had the great honor of speaking last week, he left Michael's mother, Catherine, along with his daughter-in-law, Heather, and an incredible number of family and dear friends. We are honored to have called Gene a Jersey original, and may God bless and watch over his memory and the family he leaves behind. And finally today, we remember Mirba Vega. She was among the many Cuban refugees who sought to build a new life in Union City, where she settled with her husband, Antonio, after the owner of a local bakery sponsored their passage to the United States and to New Jersey in the 1960s. While raising her and Antonio's 5 children, Mirba worked part-time as a cleaning lady. She would later drive a bus for the Hudson County Vocational Technical School. She was a renowned cook and was the heart of her family, post she fully reclaimed after a bout with breast cancer. She left behind her husband of 57 years, Antonio, and their children, Sandra, Alexis, Alexander, Tony, and Mimi, and I had the great honor of speaking with Mimi last week. She also leaves behind 5 grandchildren, Jennifer, Alexander, Tyler, Christina, and Massimo. She also left many other friends and family, both here in New Jersey and back in Cuba and around the world. When I was speaking with Mimi, this is one of these families, the Vega family. Not only did they lose Mirba, but they were crushed with overwhelming loss. Mimi said she lost her mom, obviously Mirba, her uncle, and 2 cousins, one in Jersey and one in Cuba. We thank Mirba for enriching our state, and we hope she found her American dream right here in New Jersey. May God bless and watch over her and the family she leaves behind. And may God bless and watch over all we have lost over the past 21 months. Now, let's give a well-deserved shout out to one of the businesses who were among the first to partner with the Department of Labor through our Return and Earn Employment Incentive Program. Jackson-based Roosters Roundup provides individualized child daycare to match every client's needs and foster their social and educational growth. Over the past year, Roosters Roundup grew considerably, including for the purchase of a Seaside Heights daycare center that broadened their reach. Administrator Tiffany Calderese knew Roosters Roundup would need to bring on 5 new staff members to meet the needs of both patients and kids. And through the Return and Earn Incentive Program, she was able to not only receive the funds necessary to hire and train these new child care professionals, but each of the new hires received a $500 signing bonus. I caught up with Tiffany last week to thank her for being an example of how Return and Earn can help us on the road back. And I know that kids throughout Ocean County are in good hands. When I asked Tiffany what she thought of Return and Earn, and I'm quoting her, she said, "It was a breath of fresh air." Check out Roosters Roundup. You can find them on Facebook, by the way. It's an outstanding organization. And finally, on a point of personal privilege, I note that today was the last day in office for a longtime friend and a consequential world leader, German Chancellor Angela Merkel. As Chancellor for the past 16 years, the first woman to head her nation, the second longest serving leader of the Federal Republic of Germany, and the longest serving leader of a reunified Germany, she has been a steady hand guiding Europe through economic crises, political upheavals, humanitarian emergencies, and a global pandemic. She has more than left her mark on Germany and Europe, and in many ways, those marks are original and indelible. During my 4 years as the United States ambassador in Berlin, I had a front row seat to her administration. I arrived as an ally and left as a friend. She richly deserves the plaudits, even if in her characteristic manner, she'll wonder what all the fuss is about. But she is inarguably among the most consequential European leaders of the past 75 years. Germany is a strong ally of the United States, one of, if not our strongest, and an important economic partner specifically to New Jersey. Both of these ties, though tested at times, are stronger because of her stewardship. And I have every faith that we will continue on the path of friendship and cooperation under new Chancellor and another longtime friend who I first met when he was mayor of Hamburg, Olaf Scholz. I wish Olaf the very best as he takes the reins of the government today. And that is all from me today. With that, please help me welcome the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persichilli.
Thank you, Governor. Good afternoon. Well, since Thanksgiving, we have seen cases and hospitalizations continue to rise due to Thanksgiving gatherings, increased travel, and the rapid spread of the Delta variant. As of our most recent report, the Delta variant still represents about 99% of the variants that are circulating. Currently, 75 to 80% of our hospitalizations are among the unvaccinated. Vaccination remains our best hope to beat back COVID-19 and the Delta and Omicron variants. We also know that common sense preventive health measures like masking, physical distancing, hand washing, staying home if you're sick, getting tested, have helped us reduce the spread of this unrelenting virus through several surges at this point. These measures, along with vaccination, have saved lives. Please wear a mask when indoors, especially when you are with large numbers of people whose vaccination status is unknown. Masking will also help reduce the spread of flu this season. The state is seeing moderate levels of flu right now. Fortunately, beginning the last week of October, we have seen an increase in vaccination with 400,000 doses administered last week, the highest number of individuals vaccinated since last May. As of today, more than 14.2 million doses of vaccine have been administered in New Jersey over the past year. More than 2,000 vaccination sites across the state are administering COVID-19 vaccines. Next Wednesday, as the governor shared, marks 1 year since New Jersey began the largest vaccination program in our state's history. I want to take a moment to thank the staff of all the vaccination sites, hospitals, pharmacies, FQHCs, local health departments, physician offices, churches, and mega sites for their hard work in getting us this far. We are still not where we need to be in terms of adults getting booster shots and children ages 5 to 17 getting vaccinated. We need to join together in this final leg of our vaccination journey so we can drive COVID-19 into the ground, leaving it no pathway for further spread. Over the last few days, I have spoken on stakeholder calls to hospital CEOs, county officials, FQHC administrators, local and county health departments, asking them to increase their vaccination capacity to administer more boosters and pediatric vaccinations. As of today, 19.2%, or about 145,000 children between the ages of 5 and 11 have received their initial dose of pediatric Pfizer vaccine. Among the 12 to 17 age group, 387,849 young people between the ages of 12 and 17 have completed their primary series, representing 57% of the New Jersey population in that age group. 443,521 young people between the ages of 12 and 17 received at least one dose of their primary series, representing 65% of the New Jersey population in this age group. As the holidays approach, the best thing we can do to protect ourselves, our families, and our communities is to get a booster shot. As of today, 34% of the 4.5 million eligible residents have been administered a booster shot. We are averaging about 35,000 booster doses each day, but we need to do better. 1 week from today marks the anniversary of the first COVID-19 vaccination in New Jersey. To commemorate the vaccination journey that we have been on for the past year, administering 14.2 million doses of vaccine, we want to have a special push on boosters with a Boost NJ Day on Wednesday, December 15th. We want to boost as many people as possible on Boost NJ Day, with hopefully every vaccination site in the state hosting a walk-in booster clinic on December 15th. Walk-in availability and extended hours are important to make access to the boosters as easy as possible. We will provide more detail in the coming week and will work to post a list of these special clinics on covid19.nj.gov. Governor Murphy and I will send a letter today to all vaccination sites, inviting them to participate in hosting special walk-in vaccination events next Wednesday, December 15th. It is our hope that every vaccination site in the state will set up a Boost NJ vaccination event. Currently, there are 2 mega sites open, the Gloucester County Public Works Complex in Clayton and the Burlington County vaccination site in Mount Laurel. A 3rd site will open soon in Somerset County. On to my daily report. As the governor shared, our hospitals are seeing increasing hospitalizations up to 1,409 today. This number has been increasing. Since the last briefing, there have been 2 additional reports of multi-system inflammatory syndrome in children. There are now 151 cumulative cases in the state, and one of these children is currently hospitalized. At the state veterans home, since our last briefing, there are no new cases among residents. And at the psychiatric hospitals, we have 4 new cases among patients at the hospitals, including 2 at Ann Klein, 1 in Trenton, and 1 at Greystone. The daily percent positivity as of December 4th for the state is 9.60%. The northern part of the state reports 8.38%. The central part of the state, 10.57%. And the southern part of the state, 11.29%. That concludes my daily report. Please continue to stay safe, get boosted, protect yourselves, your family, your friends, and our children. Thank you.
Judy, thank you. And I think whether it's Boost NJ Day or even beyond that, I think you folks should expect to see us putting even more of our shoulder to the wheel here in terms of public awareness to get everybody as soon as possible boosted. So thank you, Judy, for all, and as well as for the remarks today. Pat, we had some outages, I know, from high winds yesterday. We may have some snow tonight. Those items or others that you've got, great to have you. Take it away.
Thanks, Governor. Good afternoon. Yes, President Fiordaliso and I were in contact yesterday. I think the high yesterday, because of the winds, was just over 3,200 outages. As of just before this press conference, we were down to 80, so trending in a good direction. We are expecting some light flurries tonight. I don't think we're going to see much accumulation, whether that's in the northwestern part or the very southern part of the state. And I'm also happy to report the warming trend for the weekend. Looks like we're going to be in the mid 60s or so. It might be a little bit wet, but it'll be ideal weather for us hosting the Army-Navy game at MetLife Stadium, which is a special honor given that it's our 100th anniversary. And our first Colonel Schwarzkopf, graduated from West Point in 1917. Had the honor of placing a wreath on his grave on Friday. And he's just a few short rows away from General Stormin Norman. So just looking forward to a special weekend, Governor, and that's all I have.
I will be with you on Saturday at MetLife. It's also not only honoring the state police's 100th, it's the 20th anniversary this year, as we know, of 9/11, and that was also a driving reason to get it to have the game played at MetLife and in New Jersey, in the greater New York area. So, Pat, thank you for all of that. So as I mentioned a few minutes ago, unless you hear otherwise, we will be with you back in Trenton live and in person on Monday. We will be with you, as I say, live and not virtually then. With that, I think we'll take a few questions if it's okay with folks. Michelle, can you help us key up?
Of course, we will start with Matt Arko.
Hey, Matt.
Good afternoon, Governor. Actually, my question today is for the Colonel. Colonel, why did the state police let lawmakers into the State House after you said they wouldn't be allowed entry last week if they didn't show vaccination or a negative test? And also, I mean, I'd be remiss. Last month was a 2-year anniversary of a protester actually getting dragged out of the State House by state police. I mean, how is this protest any different, even though it is lawmakers?
I'm going to jump in front of Pat on this one, Matt, and he could come in and add color. Security is something that is not something we discuss as a general matter, and that includes in this case. I will say that we have the best state police in the entire United States of America. But the big story from last week is not about security. It's about the idiocy of these ringleaders who are putting their fellow members' health and the families of those fellow members at risk. This is not about freedom or civil rights. It's about their willingness to volitionally run the risk of infecting innocent, law-abiding folks who have done the right thing during this pandemic. It is outrageous, absolutely outrageous, incredibly irresponsible, unforgivable. That's the story from last week. Thank you, Matt. Michelle.
Great. Our next question will come from Julie.
Sorry, who?
Julie Dorio.
Hi, Julie.
Thank you, Governor. Can you hear me?
I can.
All right, Governor, we have a couple of questions from the NJ Spotlight newsroom for you today. First, for yourself and for Commissioner Persichilli, with another COVID surge apparently building, hospital executives say they're deeply concerned about staff shortages. They say they're losing people to temp agencies that offer higher salaries, and that hospitals often end up competing against each other and paying more to hire those same staffers back. What are your concerns about this, and should this be regulated? The number of school closings and students quarantining due to COVID cases is rising. What's your reaction? Will you mandate COVID vaccines for students? Why is there still no corrections ombudsperson? And are you concerned that the office can't fully investigate complaints at state prisons without one? And finally, undocumented workers say they face barriers when applying to the Excluded New Jerseyans Fund. What steps is your administration taking to make the application process smoother? Thank you.
Thank you. Pat, I realize I didn't ask you to weigh in on Matt's question, but I assume you're of a like mind. So let me go back to you. I apologize.
Yeah, I would just say to Matt and everybody that we take that security of that State House complex extremely seriously, and we'll certainly continue to do so, Governor. Thank you.
Amen. So Julie, I'll go through and give you some thoughts and then maybe ask Judy to come in, particularly on your first and second questions. That is a concern. We're hearing it from the hospitals ourselves. And by the way, this is in the context of a broader labor market shortage. So we've got a mismatch between openings and folks who are able and willing to work. And then in healthcare, you add to the fact that it's 21, 22, going on 22 months of just incredibly hard realities for these people, which makes the folks who are unvaccinated getting sick and willfully ignoring the science and going into these hospitals and adding to their burden even more unacceptable. Even though we keep all of them in our prayers, they are adding to the problem, not deleting it. I'm not sure regulation is the way forward, but doing everything we can on the one hand to break the back of this pandemic and get some breathing room, and everybody doing the responsible thing. And on the other hand, doing the stuff that a lot of other employers are doing, which is ending up paying more money, increased benefits, trying to figure out conditions that make the positions as attractive as possible. We have extraordinary hospitals in this state. I was on with the CEOs with Judy last week for basically thanking them for their efforts. But it continues to be a tough challenge. On schools, we owe you an update on schools. And Dan Bryant, I realized that we didn't hit that in our presentation today. So I want to make sure we do that on Monday. We still see that trend, both folks who are getting infected through in-school transmission, but also more frequently infection that is coming from outside. You never take anything off the table, but there are no plans as we sit here today to mandate vaccines in our kids. Ombudsman, listen, that's something we take very seriously. We happen to have an outstanding acting commissioner, Victoria Kuhn, at the Department of Corrections, and she's doing an outstanding job in very difficult circumstances. And obviously, these are positions that we want to fill and we will fill, but we are blessed with an outstanding leader there right now. And I think I've addressed the application process. We're doing everything we can to make it more accessible, including not in the English language, because we want to put that money to work. This is money that we scrounged to find, and we're committed to putting it to work, and we will put it to work. A lot of these programs early on, you have some teething issues, but God willing, they'll get smoothed out, and we want to be unequivocal to the folks who have been excluded for whatever reason, that these monies are there for them and that they should apply for them. Judy, back up on particularly staffing at hospitals and any observations on school cases and trends there.
So obviously, I'm pretty close to the issue of staffing in hospitals. I've had a number of conversations with the CEOs, both as a group and individually. We characterize it in three kind of buckets. First is burned out, those that have worked over the last 22 months, up front, taking care of patients that are suffering from COVID at the worst of the surges that we've had, particularly the first surge, and seeing their friends and colleagues also fall sick, and some of them dying as a result. The nurses are tired and they're burned out. And the next category is aged out. There are a number of individuals, nurses that have worked a really long time in our hospitals that were either at retirement or close to retirement. And those close to retirement, because of the circumstances that they've worked through, decided to retire. So burned out and aged out. And the item that you're talking about is what we call bought out. In other words, very attractive packages from staffing agencies for individuals to leave the employ of a hospital and work as an agency nurse, or sometimes they're, depending on where they're working, a traveling nurse. That's a difficult circumstance because in some cases they're not only bought out, they're then sold back to the hospitals that they had just left. That's a situation that it's really somewhat out of our control. What is within our control is working with the hospitals to develop operating models and economic models that support nurses staying within the confines of a hospital and really promoting more individuals entering the profession. And I'm pleased to report that, enrollees in nursing programs are definitely up. They are the heroes, or one of the many heroes, but they are heroes through this pandemic, and it's being recognized as such. And young individuals want to follow in their footsteps. So we have a number of things that we're working on, but it is a very difficult situation. We're going to pivot to cases in schools. We do know as transmission increases in our communities, those that are unvaccinated, as the governor has pointed out, put everyone at risk. And that includes children who cannot be vaccinated. Those that can be vaccinated should be vaccinated. Vaccines are safe and effective. Hundreds of thousands of kids have received the vaccines and have done very, very well. We need to protect them so that those that cannot get vaccinated right now are also protected. In times of high transmissibility and high cases, it is going to flow over into our schools, and that's what we're seeing now. And I can only suggest, if you want to protect our children, get yourself vaccinated.
Amen. And Judy, may I say one other thing on staffing, and then I don't want to keep beating this one to death here, but we are a quintessential proud union state. And among other benefits of unions is they look after each other. They look after the brothers and sister members. And you look at, for instance, a nursing community in our state, which is overwhelmingly organized. That's a good thing in times like this. And that's an asset that we've been able to lean on. And we've got outstanding leaders of the respective unions. Thank you for that. Michelle, what do we got?
Brian Thompson.
Brian, how are you?
Good, Governor. I trust you are doing well also.
Yes, I am, sir. Good to hear from you.
Thank you. As far as the school situation, we're seeing some schools actually shut down for a period of time, a week or 10 days. And some parents are actually opposed to that idea. In this case, if it is the unvaccinated, you're penalizing the vaccinated kids. Would you recommend schools go about doing it a different way, perhaps?
Is that it?
I had one other question, actually, and that is California's governor has suggested that his state could become a sanctuary for performing abortions, and that they would spend budget money to fly people from states that have very strict abortion laws post the Mississippi decision to California. Would New Jersey consider anything like that?
Yeah, on the latter, that's the first. I had missed that coming out of California. What we're focused on right now, Brian, overwhelmingly, is to codify in state law women's reproductive freedoms in New Jersey. And right now, as everyone I think now knows, women have reproductive freedom, but it's entirely based on case law. All of that is in turn based on federal law, Roe v. Wade, which, based on the hearings last week, I think there is rightful concern, as if there weren't already, that this could be impaired, limited, maybe ultimately, tragically, eliminated as precedent. We have got to get reproductive freedom law passed and signed by me in New Jersey. I don't think there's one answer on schools. I think you have to look at these one case at a time, and Judy and Ed and their teams have put, working with local health authorities, very specific parameters in place that define outbreaks, et cetera. So I don't think there's a blanket answer for you, but I do think you touch on something which I have referred to, and that is what the market will bear, what the market should bear. And if you've got 80-odd% of people eligible in the state who are at least in the process of getting fully vaccinated, and the number of folks getting boosted increasing all the time, and they're doing the right thing, it is galling, and I understand it, for folks to say, wait a minute, I'm beholden in some cases to folks who are willfully not following the science and getting vaccinated. I think in fairness on the school front, particularly schools with young kids, it's too early, in my humble opinion, not putting the public health aside, it's too early to give full complement to that notion because these kids have just become eligible recently. But I don't think you can give I acknowledge the frustration, but I don't think there's a blanket answer to this, and we have got always to put public health ahead of everything else here. And for the most part, it is working. There are increased outbreaks. There's no question about that, whether they're from in school or from out of the community. But we've got 3,500 school buildings. The overwhelming, vast overwhelming majority of them are open for business. Thank you. Michelle, take a couple more here if we can.
Next one is Mike Catalini.
Hi, Mike.
Hi, Governor. Thanks for doing this. A question for you. I see that New York and Minnesota are calling up the National Guard to deal with staff shortages in nursing homes, I believe stemming from COVID. Is that something that you're looking at for New Jersey? Is that on your radar at all? And a question for you, Colonel. I'm just curious what your reaction to last week was. It's quite a scene in the State House. Hadn't seen anything like that before. And I note that there's another voting session on the 16th of this month. Can you say how the requirement in the State House will be enforced? Will lawmakers potentially be arrested, or is that something that you could take off the table? Just curious, how things will be different in the next voting session. If you could talk about that at all, sir. Thank you.
Thank you, Mike. Don't be mad at the Colonel and me, but we've said what we're going to say about security. But I do want to underscore the absolute irresponsibility of those folks who are willfully putting other innocent members and their families' health at risk. It is completely and entirely irresponsible and unacceptable. Nothing's ever off the table, Mike, on your first question. At the moment, at least, that's not something that we believe we need to do, but we leave all options on the table. I thought Judy went through a tour de force there of the staffing challenges. I know she was speaking to hospitals. I suspect you could say a lot of what she said, if not all of it, as it relates to long-term care facilities as well. But that's the National Guard option is certainly, they've been extraordinary these past 22 months in a variety of different ways, everything from voting to mega sites, testing to vaccinations, and everything in between. That's an option you'd always want to keep on the table, but no plans at the moment. Thank you. Michelle.
Next, we'll go to Joey Fox.
Hello, Joey.
Good afternoon, Governor. So first, I've got one further follow-up question for Colonel Callahan. This is on a slightly different topic, but still about the vaccine mandate. There have been reports that some state troopers were reassigned following last Thursday. Can you elaborate on that at all? How many troopers were reassigned? Were any of those reassignments already scheduled, or was it, because of the event of last Thursday? And then for Governor Murphy, I've got a few voting-related questions. One, so there's a school district referendum that happened last month in Hunterdon County that's separated by only 2 votes and may go to a recount, but your administration is opposing it via a deputy attorney general. Can you explain why your administration, through this deputy attorney general, is opposing the recount? Runoff elections held yesterday had turnout of around 12%. Do you think the state ought to re-examine these very low turnout runoff and special elections and rework them in some way? And finally, what are the chances of Andrew Zwicker's sort of long-suffering ranked choice voting proposal becoming law? Thank you.
Joey, I'm going to disappoint you as well. Nothing else to add on State House security, but thank you for asking. The school recount I'm not familiar with, but that's a question for the AG. And maybe Dan Bryant, can you connect Joey to somebody in that neck of the woods? No specific step reaction to runoff elections that had 12% participation, but that level of participation is unacceptably low. So count me in for any creative ideas that would get participation up. Again, without any regard to who you vote for, but with a lot of regard to whether you vote at all. That's why we did early in-person voting. I don't care, again, who you're voting for, but we want to find more ways to make it easier to vote. Nothing new on ranked choice of voting. One thing going back, Pat Callahan reminds me on National Guard. I should say that they have been, DMAVA has been and continues to be very helpful to some extent at vet homes and elsewhere. So there is some presence that exists already. I was answering it more in the context, are you thinking about taking a quantum uptick in the sort of daily drumbeat, great work that they've already been doing? So I want to make sure I said that. And again, they are largely, if not entirely, Pat, I think, in the DMAVA homes themselves and not in the broader long-term care community. Maybe we'll do a couple more. Michelle, is that okay?
Great. Next, we'll go to Shlomo Shore.
Hello, Shlomo.
Hi, Governor. Thank you very much. I just have one quick question for the Health Commissioner. We're now approaching the year anniversary or so of the first COVID shots. Are we any clearer on the effectiveness of the immunity and is it waning? And related to that, with the COVID number, the vaccine numbers on the dashboard, I think originally intended to signal where we are in terms of the herd immunity. Will those numbers be revised downward as we move on to the boosters and limited effectiveness of the original shots? Thank you.
Shlomo, Judy, tell me if you agree with this thought. Can you address that second part, which is really a CDC decision in terms of what constitutes fully vaxxed? But I've been trying to get, as I know you have Ed Lifshitz to come in from the bullpen. The first question that Shlomo asks is probably an ideal one, and that is observations on effectiveness, efficacy, waning immunity, et cetera, of the vaccines. Am I right, Judy, to say that the discussion or decision as to whether somebody's fully vaxxed, that's a decision that's a federal one that lies with the CDC?
That's correct.
Are you okay if we pull that in from the bullpen here on the first part? And even though there's a lockout of players, we found a loophole, we got you in the game.
Thank you. I'll try not to throw a wild pitch, but let me start out by saying very clearly, without a doubt, vaccines continue to be the single best protection we have against this disease, and I strongly encourage everybody to go out and get them. What we're talking about with vaccines over time is kind of two different things. One is its effectiveness over the Delta variant, which is still the very large majority of all cases in New Jersey are still related to the Delta variant. And we have seen over time somewhat that the vaccine effectiveness has waned somewhat, particularly against the more mild disease, but somewhat against the more serious diseases as well. And that's why CDC came out, and we're strongly supporting and telling people to go out and get those boosted. And we all are now recommending that all people who are eligible, essentially everybody over the age of 18, should go ahead and get that third dose, that booster dose of the vaccine. And we do believe that that will bring it back up to where it had been. The second is what's in the news a whole lot recently, which is related to Omicron. And some of the things that were very concerning about Omicron, and certainly caught people's attentions, including myself, is that there are both characteristics in the virus itself and early indications that people becoming infected with this virus had been vaccinated before, meaning that this variant could evade the body's immune system and could make people ill even if they'd been vaccinated. And that is still concerning to me because I think that clearly against the vaccine, particularly people who got the original 2 shots, that is the fact that we are seeing more and more around the world that people who've been vaccinated are coming down with the variant, although luckily it tends not to be as severe. Now, just today, we did begin getting some more information from Pfizer as well as other people as well that very clearly points out 2 things. One is that against the Omicron variant, the original 2 doses of the vaccine still seem to work quite well against serious disease, meaning what they saw was a sharp drop off as far as protecting against getting mild illness, but against getting hospitalized or death, it was still quite effective. And even more importantly, what they found was that it looks like if you go ahead and you get that 3rd dose, and in this case it was Pfizer, but no reason to suspect it wouldn't be with Moderna or anything else, that your antibodies get boosted so high that essentially your levels get back to the protection that you had originally when you got the first 2 doses back in the spring. So that's kind of my very long answer to come back to this point. The vaccines are good. They're our best protection against illness, the best protection for ourselves, for our families, for our neighbors, and absolutely encourage people, go ahead and get vaccinated, whether it's next Wednesday or any other day, go ahead and get that booster, get that 3rd shot.
And well done as always. I've gotten the question from a number of folks, is the booster one and done for the rest of my life, or is this going to be an annual thing or somewhere in between? And Judy and Ed, I think, is it fair to say there's no one on the planet Earth who knows the answer to that question?
Certainly nobody in this virtual room. and yes, that is definitely true. We are learning more every day. We do not know what variants will be coming down the road. We do not know for sure how long the protection will last. So no one knows that answer for sure. And in a few more months, we'll see. There's a pretty good chance we'll end up needing to take something at least on an annual basis, let's say, but no, that is not known yet.
Great, thank you for that. Judy, anything you want to add, or are you good? Good. Michelle, let's do one more if that's okay.
Great, then the last question will come from Alex Zidane.
Hello, Alex.
Good afternoon, Governor.
Good afternoon.
For Dr. Lifshitz, can you please tell us how concerned we should be about Omicron? Is it a concern to you? And how many cases do we currently have in the state as of right now? And for the governor, I'd like to ask you, did you order state troopers to the doors of the Assembly and Senate last week to enforce the vaccination or test mandate? And if so, why? For Colonel Callahan, if state troopers can't arrest lawmakers, why were they there? Were they there as an intimidation tactic? And did the governor order you to do so?
Is that it?
Yes.
Thank you, Alex. Neither Pat nor I have anything more to offer on questions 2 or 3, so sorry to disappoint you on that. I guess on the first one, Judy and Ed, there's rightful concern, but this is not, let's avoid hysteria. Let's avoid, the science is incredibly incomplete here. I was on with the White House yesterday, and Tony Fauci said he thought a couple of weeks from now, we'll have a little bit of a better handle on it. But I'd say there's sober concern, but with a lot of this to be determined. And in terms of cases, Judy, am I right in saying we have 1 confirmed, several that are under review and or being sequenced? Is that a fair assessment?
Yes, correct. Yeah, 3 that are under sequencing and one confirmed.
And do you agree with the sort of, we should be concerned, but let's wait and see what the science, how that plays out? There's no need to panic right now. Is that fair to say?
Absolutely, 100%. You said it, President Biden has said it, and much lesser, I'll say it as well. One of the things with this virus in general, I think we need to learn to live somewhere between complacency and panic, meaning we have a certain percentage of the population who would like to think that everything was over and not need to take any precautions at all. And on the other hand, some people are panicking over every bit of news and worrying about Omicron and everything else. when it comes to Omicron in particular, yes, we do not yet know exactly how bad it will be. I am certainly concerned. I'm feeling somewhat better over the last couple of days with some of the news from Pfizer and other studies. But as you've mentioned, we'll learn a whole lot more in the next 2 weeks or so. And as far as in general goes, it is, to some extent like looking at the weather. Let's say I want to be driving or something. When the weather gets worse, I want to take more precautions. I want to be more careful. And I think that's what we're going to have to be doing with this virus, meaning that there'll be times when there'll be less of it around and we'll be, a whole lot freer, and other times where the concern goes up. Even without Omicron, our cases are increasing now. We're going into that holiday season. As been mentioned, people are getting together. It's colder. There'll be more virus spread, and that is concerning to me as well. So I'm going to come back and say what everybody else has said, and sorry for taking up the time, but vaccinate, common sense precautions for yourself and your family, wear masks, particularly indoors around people that you don't know their status of, and just take some general precautions.
Judy, anything you want to add to that?
I think the last part of Ed's response is what we have to hold on to. We know that the non-pharmaceutical interventions, masking, physical distancing, washing your hands, we know that all works. So whether it's, whether it's Omicron or Delta, we should be instituting the non-pharmaceutical interventions every day.
It's a good reminder. Alex's question is a good one, and it's a good reminder to reiterate something that I think was said before many times. The expectation, again, it's just expectation, right? The expectation is we will not be managing this pandemic to get to caseloads of 0. It's just not the likely outcome. This feels like it's going to be at some level of ebbing and flowing. And I like Ed's weather analogy. Where there's going to be periods of time when you have to be in a heightened posture. And so that's just the reality. And I think that's a long-winded way of saying, are we concerned? Yes, we would be abrogating our responsibilities if we weren't, but it's a sober, objective assessment based on incomplete data. Let's let this play out. And in the meantime, remind everybody that we're not battling right now, to the best of our knowledge, not one case of Omicron is in a hospital in New Jersey. This is 99.9+% Delta. And that's the task before us. So to each and every one of you, thanks for those good questions. On behalf of Judy and Pat and Ed and Paramel and Dan and the rest of the team, we say thank you. Again, we'll be back with you live and in person next Monday at 1 o'clock in Trenton. Please keep up the great work, folks. Do the smart stuff, the basic stuff that we know works, and get vaccinated. And if you're vaccinated, get boosted. Thanks, everybody. God bless.